Good everyone, my name is Honorary Victor and I am a neurology applicant. I will be doing the Ching Cheng's comprehensive review in clinical neurology. We've done questions 1 to 49 and right now we will be doing questions 50 to 54. So let's start with 50. We have a 39-year-old woman who presents to your office with left-sided facial weakness involving the entire left half of the face. Taste is impaired and sound is excessively loud in the left ear. She denies problems with dry or running eyes. A lesion in which of the following facial nerve locations could explain these symptoms? So we have options A, the left facial nerve nuclei. We have options B, between the geniculate ganglion and the stapedius nerve. We have option C, between the chorda tympani and the stylomastoid foramen. We have option D, between the stapedius nerve and the chorda tympani. And we have options E, between the facial nerve nucleus and the geniculate ganglion. Now, to understand this question, you need to actually have a thorough understanding of the pathway or the course of the facial nerve. Before we dissect this question, let us take a brief moment to go through the anatomy and the pathway of the facial nerve. Now, it's important to note that the facial nerve is actually a mixed nerve. And by a mixed nerve, basically, it does four different things. So, one, it contains motor fibers that innervate the facial muscles, the muscles of facial expression. Two, it has parasympathetic fibers that innervate the lacrimal gland, the submandibular gland, and the sublingual salivary gland. Three, it has special sensory afferent fibers for taste from the anterior to third of the tongue. And four, it has somatic sensory afferents, which comes from the external auditory canal and the pineal, right? So four different types of nerves in quotes, which makes up the facial nerve, and they include one, the motor, two, the parasympathetic fibers to the salivary glands, which includes the lacrimal, submandibular, sublingual glands, and three, the special sensory afferent fibers for taste from the anterior to third of the tongue, and lastly, the special or the somatic sensory afferents from the external auditory canal and the pineal. Now, lesions to the facial nerve can be localized by remembering the course of the nerve from its origin to where it terminates. Now, you have to keep in mind that if you have a lesion on the facial nerve, everything before that lesion will be spared, and anything after that lesion would be affected. And bear in mind that a lesion at any point of the facial nerve can actually cause issues with facial expression due to affectation of the motor um, due to affectation of the motor fibers. So a lesion anywhere from the facial nerve nucleus to the distal branches can cause facial weakness in the peripheral distribution. So let's start. Basically, from the pontomedullary junction, we have two roots, and these two roots actually merge together to form the facial nerve itself. Now, one of these roots actually provide motor innervation to the facial muscles, and the second root is actually a mixed visceral nerve that carries parasympathetic fibers, and we call this the nervus intermedius. Now, the preganglionic cell bodies of the parasympathetics are actually scattered in the tegmentum of the pons. So we call that the pontine tegmentum. And these scattered preganglionic cell bodies together, we call them the superior salivatory nucleus or the superior salivatory nuclei. Now, the fibers of these superior salivatory nuclei travels through the nervus intermedius. So now that we have our facial nerve, which comes from two roots, it courses laterally through the cerebellopontine angle, and it goes along with its brother, the eighth cranial nerve, which we call the vestibulocochlear nerve, and they enter into the IAC, the internal acoustic canal or the internal acoustic meatus, and this leads into the facial canal. Some people call it the fallopian canal. Now, the facial canal is actually located in the petrous part of the temporal bone, and it consists of three things: one, the labyrinth; two, the tympanic; and three, the mastoid segment. Now, within the labyrinth segment, what happens is that the facial nerve makes a U-turn or a bend, and this bend goes backward, and this bend looks like a nail, so we call that the genu. And that genu forms a swelling, which we call the geniculate ganglion. Now, this geniculate ganglion actually contains nerve cell bodies of taste axons from the tongue, as the anterior two-third of the tongue, and somatic sensory axons from the external ear, auditory meatus, and the external surface of the tympanic membrane. Now, the parasympathetic greater perosteal nerve actually arises from this geniculate ganglion and is actually the first branch of the facial nerve. Now, the greater petrosal nerve actually leaves the geniculate ganglion anteriorly, enters the middle cranial fossa extradurally, and then enters the foramen lacerum and routes to the pteropalentine ganglion, which also called the sphenopalatine ganglion. Now, from the pteropalentine ganglion, we have postganglionic fibers that travels with the maxillary portion of the trigeminal nerve, which we call V2, which supplies the lacrimal gland and the mucosal gland of the nasal and the oral cavities. Now, after the geniculate ganglion region and the branch of the greater perosteal nerve, the facial nerve axon then pass backwards and downwards towards the stylomastoid foramen. Now, the next branch, as the facial nerve passes downward, is the nerve to the stapedius prior to exit from the stylomastoid foramen. Now, remember that the stapedius muscle actually helps to dampen the oscillation of the ossicles of the middle ear. And if you have a damage to the stapedius nerve and muscle, you're going to have hyperacusis, in which sounds are actually heard much louder. Now, after the branch of the stapedius nerve and just before the exit from the stylomastoid foramen, the facial nerve then gives off a third branch called the caudal tympanic nerve. And the caudal tympanic nerve actually passes near the tympanic membrane, where it is separated from the middle ear cavity by a mucous membrane. It continues and goes anteriorly, and then it joins the lingual nerve of V3, where it carries general sensory afferents for the anterior to third of the tongue. Now, the caudal tympanic contains secretomotor fibers to the sublingual and the submandibular gland, as well as visceral afferents for taste. The cell bodies of the gustatory neurons lie in the nucleus ganglion and travels via the nervus intermedius back to the nucleus tractus solitarius. So, we can say that the nervus intermedius carries efferents from the superior salivatory nucleus and taste afferents to the nucleus tractus solitarius. Now, it is very important to remember that the parotid gland are innervated by the glossopharyngeal nerve, whereas other glands in the head and face are innervated by the facial nerve. The facial nerve then exits the stylomastoid foramen, turns anterolaterally, and travels through the parotid gland. After the facial nerve exits the stylomastoid foramen, it gives off different branches to the various facial muscles. So, let's go back to our question. So, back to question 15. A 39-year-old woman presents to your office with left-sided facial weakness involving the entire left half of her face. So the entire left half of her face basically means we have a lower motor neuron lesion. Taste is impaired and sound is excessively loud in her left ear. So sound being excessively loud in the left ear means that something is going on with the stapedius, with the nerve to the stapedius. She denies problems with dry or running eyes. That means that there is no issue with the geniculate ganglion, which gives rise to the greater petrosal nerve that innervates the lacrimal gland. So that means that our lesion is somewhere after the geniculate ganglion, just before the stapedius. So a lesion in which of the following facial nerve look, a lesion in which of the following facial nerve locations will explain the symptoms. So option A says a left facial nerve nucleus starts first. B says between the geniculate ganglion and the stapedius nerve, so that will be true. Option B. C says between the caudal tympani and the stylomastoid foramen. That does not explain it. D, between the stapedius nerve and the cauda tympani. That will not explain the reason why this patient has hyperacusis. Remember that it has to occur before the stapedius nerve. And then D is between the stapedius nerve and the cauda tympani, so that's false. E is between the facial nerve nuclei and the geniculate ganglion, that's false. So our answer is option B. Now question 51. If this patient presented with the same symptoms, okay, except that she only has left facial weakness and taste impairment. So left facial weakness can be as a result of a lesion in any part of the facial nerve. But then here we're saying that she has taste impairment, so her taste is gone. She has hyperacusis, but then there's sparing of the lacrimal gland. Okay. Without hearing complaints mentioned. Okay. So question 51. Okay, let's go for question 51. If this patient presented with the same symptoms, except that she only has left facial weakness, so left facial weakness can be as a result of a lesion in any part of the facial nerve. Taste impairment, so taste impairment means that there's an issue somewhere before the cauda tympani. Without hearing complaints mentioned above, so there's no hearing complaints. That means that this lesion occurred between the stapedius and between the nerve that supplies the stapedius and the cauda tympani. The question is, where would you expect the lesion to be? So A, between the geniculate ganglion and the stapedius nerve, that's false. B, the left facial nerve nuclei, that's false. C, the facial nerve nucleus, between the facial nerve nucleus and the geniculate ganglion, that's false. D, between the cauda tympani and the stylomastoid foramen, that's false. So look at what we just said. E, between the stapedius nerve and the cauda tympani. That is strong option. C is the right answer. So, for question number 52, which of the following is true regarding the facial nerve and its branches? Okay. So, the cauda tympani provides parasympathetic innervation to the nasal gland. That is false. The cauda tympani provides sensation, it actually carries afferent signals from the anterior third of the tongue. So that's false. B, the greater petrosal nerve provides parasympathetic innervation to the lacrimal gland. That is true. C, the parasympathetic innervation to the lacrimal gland travels in the ophthalmic division. No, it travels through V2. That's the maxillary division. So that's false. D, the cauda tympani provides innervation for taste sensation into the posterior monitor. That's false. To the anterior to third of the tongue. And E, the pteropalantine ganglion contains nerve bodies of taste axons for the tongue. That's false. What contains nerve bodies for taste axons for the tongue is the geniculate ganglion. So, question 53. Which of the following cranial nerve nuclei supplies the parasympathetics to the head and neck? So remember we just said it is the superior salivatory nucleus. So let's see. Options A, superior salivatory nucleus. So that is true. Let's think about it. Option A is the answer. Question 54. Which of the following glands are not innervated by the facial nerve? So remember we just said that even though the facial nerve passes through the parotid gland, it does not innervate the parotid gland. So A, the lacrimal gland, that's false. B is the nasal mucosal gland, that's false. C is the sublingual gland, that's false. D is the parotid gland, that's true. And E is the submandibular gland, that's false. So option D is the answer.